Roadmap to Success and Happiness. Chapter 32, Disease. It is in sickness that we most feel the need of that sympathy, which shows how much we are dependent upon one another for our comfort, and even necessities. You need to be careful about contracting disease. Two risk areas are water and liquids like juices, which breed disease germs fastest. Consuming exposed foods sold on streets is also risky. Raw foods not properly washed, cold meats, dairy products, and other cold foods can also be easily contaminated. Cholera, jaundice, and various types of dysentery and diarrhea are common diseases contracted in this manner. Vaccinations or prophylactic medications are a preventive measure one can resort to when there is an increased risk of disease, such as while traveling or during an epidemic. Flus are a common infectious disease. They are easily contracted by the sneezing or even the close proximity of an infected person. One's hands, which touch one's nose, mouth, or even eyes after contact with an infected person, are another means of transmission from one person to another. Germs are also transmitted through door handles, touched by an infected hand just before you touch them. Washing one's hands frequently is hence a good practice. Malaria is caused by the bite of the female Anopheles mosquito. It is difficult to diagnose and can lead to brain fever and even death. You can protect yourself by oral preventive medication, or the use of various mosquito repellents. Most other common diseases are caused by poor diet, a lack of exercise, or genetics. Stress is a big killer. When stress occurs, the hypothalamus sends a message to the pituitary gland, which signals the adrenal gland to increase the release of the stress hormone, cortisol. This results in higher abdominal fat storage and increased release of insulin, resulting in increased risk of heart ailments, stroke, and diabetes. The risk is compounded by a lack of exercise, smoking, and excessive eating and drinking. Arthritis is an ailment of the bones that can afflict anyone, even someone as young as 30. It is not just an old age ailment. It affects the joints of the fingers, hip, and knee, and the bones of the vertebrae in the back of the body. While age can be the cause, genetics, obesity, bad diet, and excessive alcohol consumption can also be causes. A good diet, moderate exercise with low impact on the joints, like swimming, and calcium supplements, can delay or prevent its onset, though it is very prevalent as one ages. It is the wearing out of the cartilage that acts as a friction inhibitor between the joints of bones. The Institute of Medicine in the United States convened an expert panel to study pain. Members of the panel concluded that pain can be considered a disease rather than just a symptom. Research has been carried out to determine new methods to regulate pain in addition to traditional NSAIDs like aspirin and ibuprofen, which have been relied upon for decades. An accidental pinprick or push or kick feels less painful than an intentional one. So if one is being willfully hurt, it pains more for the same intensity. This was concluded by a study at Harvard University carried out by graduate student Kurt Gray and Professor Daniel Wagner, that involved 48 volunteers. The mind distills meaning from social interactions, and reacts accordingly. Methods to reduce pain include the injection of a viral vaccine, which can inhibit the flow of the pain messages to the spinal cord and brain, and gene therapy, which enables the brain's natural pain inhibitors to enhance the body's ability to produce natural inhibitors, like the analgesic chemical enkephalins, that help dull the sensation of pain. However, these can be as habit-forming as opiates. Learning to focus on positive thoughts has been found to be a good way to reduce the feeling of pain. Dr. Sean Mackey, head of the Division of Pain Management at the Stanford University Medical Center in California, has found that the feeling of intense love alleviates the sensation of pain in the same manner as drugs, like morphine and cocaine, by triggering the flow of dopamine, that influences mood and the feel-good factor. It acts as an analgesic. Similarly, viewing pleasant sights, listening to favorite music, or reading an enjoyable book, also tend to soothe pain. Meditation is yet another pain alleviation technique. The human mind is an amazing mechanism. People who have lost the sense of sight or sound, develop new ways to recognize people, or perceive speech by lip reading. While learning is easier in childhood, even as one ages, one can learn new skills. The European Heart Journal established that there is a relationship between coronary disease and satisfaction in 4 areas of life, namely job, family, sex life, and self. Treat your body with respect, and you can have a disease-free, healthy, long life.